Third speaker will be Dr. Michelle Taylor. Dr. Taylor, a pediatrician, received her undergraduate degree from Howard University, a master's degree in epidemiology from UT Health Science Center, a second master's degree in public administration from the Harvard Kennedy School of Government, and her doctorate in public health from Johns Hopkins University, and earned her medical degree from East Tennessee State University. Prior to her current role, Dr. Taylor was Associate Medical Director and Deputy Administrator for Maternal and Child Health at the Shelby County Health Department. Dr. Taylor is currently the Division Director for Health Services. In this role, Dr. Taylor leads the team that plans, organizes, and maintains public health programs and services for Shelby County. She is also a Lieutenant Colonel and Residency-Trained Flight Surgeon in the Tennessee Air National Guard. This all translates into she is awesome. Thank you, Debbie and Reggie, for all that y'all do. Ladies and gentlemen, please put your hands together for Dr. Michelle Taylor.
Had to check and see if it's still morning. Good morning, everyone. All right, I know I'm the only thing standing between you and lunch, so I will not be up here long, but I'm really excited to be here and talk to you about how we work with all of you to provide data and to do this very vital work in the community. But first, before I do anything else, I need to recognize our Shelby County Health Department team. So if everybody from Population Health and our data team, epidemiologists and data analysts, if you would stand up and be recognized. Thank you very much. They can't stand it when I do this, but I cannot do the work that I do, and we cannot do the work that we do without them. So thank you all so much. So let's get rolling. Data to action. We're going to see if this works. Am I pressing the right thing? I am. All right. So we're going to go through several things today. I apologize in advance if I talk too fast, but I will try not to. We're going to discuss definitions of substance use, Shelby County demographics, the data the health department gathers about fatal and non-fatal overdoses, spike alerts, and how we are using this data to address the opioid overdose epidemic. So this is a very busy slide, but basically what it's telling you is that a substance is any kind of drug that can change a person's state of mind and body functions. Based on the 2020 National Survey on Drug Use and Health, 40.3 million Americans aged 12 or older had a substance use disorder in the past year, since 2020. That's a lot of people. Couple more definitions. Dependence, and everybody in here knows this, is a chronic disease caused by uncontrolled use of a substance that affects health and social function. Many substances can cause dependency if used in excess, including alcohol, stimulant drugs like methamphetamines, cocaine, and opioid drugs. And then tolerance is a person's diminished response to a drug, which can occur when the drug is used repeatedly and the body adapts to the continued presence of the drug. Eventually, users must consume larger doses to achieve the same effect, putting them at risk of overdose. And if you all didn't know that, you wouldn't be here today. But, you know, in this academic setting, it's always important to level set. So let's talk about some Shelby County demographics. The total population of Shelby County in 2021 was 924,454 people, so just shy of 1 million people. People who identify as female are the majority and comprise 52.5% of the population. So women are running things, right? And people who identify as male make up 47.5% of the population. So why am I showing you this? Just gives you an idea of where we are in the county right now. So let's talk about the county by race. African Americans comprise the majority of the racial and ethnic population at 53%. Whites make up 34.6% of the population, and the Hispanic or Latinx population is included in that white percentage. The remaining 12.5% of the population identifies as mixed race or other. Educational attainment is a factor that impacts socioeconomic status and health. Here, you see a breakdown of the educational attainment of the Shelby County population aged 25 and older. As you see, just over 33% of the population has attained a bachelor's degree or higher level degree. However, more than 37% of the county's population has only a high school diploma or less. 6.7% have completed some high school, and 3.7% have a less than 9th grade education. Lower educational attainment adversely impacts an individual's ability to obtain employment that pays a living wage. And why is that important to this crowd? Well, we know that if somebody has a higher educational attainment, it's not a complete protective factor against substance use disorder, but it is one of those protective factors that even if somebody with a higher educational attainment ends up having that disorder, it's more likely that they'll understand and eventually get to a point of wanting to get treatment. Employment status impacts health insurance coverage. And so I'm always harping on this, and this is super important, especially for our region. 55% of the population in 2019 had employer-sponsored health insurance. 22% of the population has TennCare, Tennessee's Medicaid program, and 16% are covered by Medicare. 12% have no health insurance, and a total of 15% have private coverage or coverage from the military, VA, or someplace else. Because Tennessee has not expanded Medicaid, many of our uninsured population here in Shelby County do not qualify for TennCare, even though they would qualify for Medicaid if they were living anywhere else in the country. But their incomes are so low that they are unable to afford coverage on the individual market. Without insurance coverage, many with substance use disorder cannot afford treatment. So me and the team thought it was really important for you all to see this and see these statistics, because we know that all of you all are encountering folks every day who fall into that bucket of uninsured and not able to qualify for Medicaid because we are in a Medicaid non-expansion state. Almost 18% of the Shelby County population has an income below the federal poverty level. That is significantly higher than the poverty level in the rest of Tennessee and almost 40% higher than the United States overall population living below the federal poverty level. Poverty not only makes health care more difficult to afford, it also is a factor in several chronic health conditions. And think about it. The reason that is because if you're trying to take care of basic needs like making sure there's food on the table, making sure you have shelter and a roof over your head, making sure that maybe your kids get to school, the last thing you're going to be thinking about is getting into treatment or any other aspect of your health. And so it's really important to understand where we are as far as our poverty levels here in Shelby County. So we get to the meat of it now, and I'm going to go through these slides. Shelby County Health Department has access to very valuable data about both fatal and non-fatal overdoses. Our opioid response efforts are data-driven, allowing us to bring resources to bear in specific zip codes and communities where overdoses are highest. And hopefully you all here in this room are also able to use that data to deliver your services as well. Since before we began monitoring the opioid overdose epidemic in Shelby County, we already had vital records data, death certificates, as well as hospital discharge data. This data, we began monitoring this data in 2017 when we started to ramp up our response efforts. Although this data can be very useful, there is a significant lag time between the incidents and reporting. Therefore, it's not very helpful in making real-time overdose response decisions. Fortunately, we have developed other tools that give us access to data about overdoses in almost real time. And you're seeing some of those surveillance data up there, all right? We have access to real-time data from hospital emergency departments. This data source is known by the acronym ESSENCE, and you see that up there, which stands for the Electronic Surveillance System for the Early Notification of Community-Based Epidemics. We typically receive information from participating emergency departments within 24 hours of a patient encounter. We use syndromes in ESSENCE to get pre-diagnostic estimates of health conditions being reported from emergency departments. Syndromes are combinations of words that may be related to a patient's medical condition, but are not confirmation of a clinical diagnosis. This data provides information about non-fatal overdoses. And so I just went through what ESSENCE is, all right? The next one, the West Tennessee Regional Forensic Center provides data about fatal overdoses in Shelby County, including time and location of death, items found with the decedent, including, or the person who they have found dead, including drug paraphernalia, exam notes, and toxicology results. However, there is a significant lag time between autopsy and the availability of toxicology results. So always remember that if we have someone who is overdosed fatally in the community, we may suspect the overdose, but until those toxicology results come back, we can't confirm it, and so that's where the data time lags. Another innovative data source that gives us virtually real-time information about overdoses is the Overdose Detection Mapping Application Program, known as ODMAP. It allows emergency response agencies to enter data about emergency calls involving overdose, including the address of the overdose event, demographic information about the individual who is considered a case, whether the individual was transported, and if naloxone was administered on the scene. This information is very useful. Only 3 agencies are actively contributing to ODMAP, but we are working hard to get Bartlett, Collierville, and Shelby County Fire to enter data in order to create a more complete database. And right now you can see who is an active contributor there on the screen. And so those other places do have the ability to enter into ODMAP. So for all of you all who have spheres of influence with Bartlett, Collierville, and the Shelby County Fire, please, please, please encourage them to start being active contributors to ODMAP. And this is just a visual representation of what you see on ODMAP. It's being used in a number of cities and jurisdictions in the United States. This map provides a snapshot of data from around the country, including suspected overdose events, suspected overdoses that resulted in death, and naloxone administration. So let's talk about naloxone distribution. It has become a very important part of our opioid response, and I know you all know this. Emergency service partners carry naloxone and administer whenever they suspect an overdose. This summer, Shelby County Health Department joined community partners in naloxone distribution. Naloxone and fentanyl test strips are now available at all our public health department sites free of charge. Memphis Fire Department reports naloxone usage through ODMAP, including the number of people who receive naloxone and the number of units of naloxone given. Sometimes it takes more than 1 unit to revive someone who has overdosed. And we know this as a community as well, right? And so we know that there are a lot of things being added to drugs that folks that are getting on the street to make it more difficult for naloxone to work. And so it couldn't be more important to have community partners like you all to be able to counsel people on the proper administration of it and the fact that they may have to give more than 1 dose. So we're going to get to a little overdose death data. Overdose death data shows the overdose epidemic has become more deadly over time, unfortunately. This slide shows age-adjusted opioid-involved overdose deaths per 100,000 population. Shelby County's overdose death rate has risen steadily from 2016 to 2020. The growing availability of fentanyl is thought to be a major factor behind this increase. Even very small doses of fentanyl can kill. It is often added to other street drugs. Unsuspecting users may receive a lethal dose of fentanyl without knowing it. Another thing that this crowd knows, a lot of times when I'm talking to different audiences about this, I explain to them, and I'm going to age myself, so I just turned 48, right? And I explain to them that there are a lot of people out there, especially in their 40s and 50s, who have been recreational drug users since their 20s, right? But what they don't understand is that the drugs that they were using 30 years ago are not the same drugs that are out there right now. And so it behooves us to really explain that in ways that our community can understand so people know how to protect themselves. So that's why these naloxone and fentanyl test strip kits are so important, because especially in those older age groups, they can test their drugs before use. And you can have an argument about how you feel about testing your drugs before use and whether you should be doing it. But what we're trying to do in this room is save lives. And we're going to do that in any way possible, correct? But like I said, we have a big population who does not understand that the drugs now are very different than what they were using back in the 90s. All right. This slide shows the age ranges that account for fatal and non-fatal opioid overdoses as of October 14, 2023. The bar chart in purple shows the non-fatal emergency room visits. The average age of non-fatal overdoses is 39.6 years old. Compare this age range to the fatal overdoses shown here in green. The average age of overdose death is 42.3 years, and these deaths are most frequent in the 40 to 49 age range. Users may overdose several times before finally dying. We must help users receive treatment after non-fatal overdose incidents because their next overdose may be their last. And this is always hard data to present, but it's necessary data because it presents an opportunity to not only reach our children and adolescents early, but to also reach some of these older individuals that we certainly know about, but when you see it on the screen, you understand that we're needing to give education across the board on age range. You can see on this chart, even you've got a significant number who are greater than 60 years old, right? More than you would expect. And so we really have to do a great job of reaching every age group to protect lives. All right. This slide shows the racial breakdown of fatal and non-fatal overdose cases this year as of October 14th, with non-fatal overdose emergency room visits shown on the left and overdose deaths shown on the right. African American men, shown in dark blue, are now the most likely population group to suffer overdoses. They account for half of all emergency room visits and 42% of all deaths due to overdose. The next most likely population group to overdose is African American women, shown here in light blue, who account for 20% of all emergency room non-fatal incidents and 16% of all overdose deaths. 28% of deaths are among white males, shown in light tan, and only 11% of deaths, shown in dark tan, are among white females. And when I say only, I'm not being irreverent. We know that even one death is too many. Did I flip? I think I did. I'm not sure. Okay. Early in the overdose epidemic, white males were the most likely demographic group to experience fatal and non-fatal overdoses here in Shelby County. This slide illustrates that the demographic shift took place between 2020 and 2021. Let's see, maybe I need to go back one. Yes. Sorry about that, you all. The pie chart on the right shows the demographic breakdown of all suspected overdose-related deaths in 2020. 34% of those deaths were among white males, shown here in the same color as the previous charts. From the end of 2020 to the end of 2021, the demographic balance tipped to African American males, making up the majority of overdose-related deaths. Their percentage of deaths jumped from 33% in 2020 to 43% in 2021. At the same time, deaths among white males decreased from 34% to 25% of the total. Our epidemiologists are still investigating this shift in demographics, but it indicates that we must shift our strategies to better reach the African American male population. And so I will tell you, just knowing a bit about epidemiology, is that, there could be a number of factors here. One is that the numbers are totally real and those shifts have happened, more than likely, yes. But the other is that we know that there can be reporting shifts over time. There can be shifts in how we report deaths to overdose, mainly because we just came through a 3 to 4 year pandemic. And so we're still investigating why there's been such a seismic shift. But what we do know is that the work that all of you all are doing is so vital to the community, and we know we have a lot of lives that we can still save. All right, this slide shows non-fatal and fatal overdoses during the past 18 months of data. Once again, non-fatal incidents are shown in purple, and the fatalities are shown in tan. This year, fatal overdoses peaked in May and again in September. However, the trend for both indicators is relatively flat, with occasional high points and low points. And you can see that on the trend line. So my team knows that I love when I'm able to put maps up, because I feel like the map tells a very strong story about what's going on in the county. This map shows the suspected opioid overdose deaths by injury location by zip code, meaning the zip code where the person was suspected to have overdosed, it occurred in that zip code. So it doesn't mean that that person necessarily lived in that zip code, but it's showing you where they are suspected to have overdosed. Zip codes with the highest concentrations of death are shown in dark red. In each of these red zip codes, including 38109, 38127, 108, 122, and 118, between 48 and 58 people lost their lives to overdose. In the zip codes marked in dark orange, between 36 and 47 people died of overdose. And the 3 zip codes marked in light orange had 25 to 35 overdose deaths. The zip codes shown in yellow show that there were less than 24 overdose deaths in those zip codes, and the lightest yellow zip codes experienced less than 10. All the yellow zip codes are located in the eastern part of Shelby County. This pattern will be repeated in the next few slides. The areas shown in green are parks, and the light yellow area is Memphis International Airport, because we like to give people kind of some landmarks. And what I will tell you about this map and the other maps that you're going to see, if I put any health indicator up here, let's say I was talking to a group about chronic disease, or I was talking to a group about heart disease or diabetes or any number of health issues, the map is going to look the same, okay? The only thing that's going to be different is the shading and the coloring that the team used. So we really, as a team of community partners, need to also start thinking about, how do we change these maps for the better? How do we change these maps so that we can save lives in these areas who have a disproportionate burden of the disease, including substance use disorder and overdoses? They suffer a disproportionate burden of that. And we have to start thinking of it in those terms. All right. This map shows reported residents' zip codes for the non-fatal suspected overdoses who received treatment in hospital emergency departments in Shelby County. The zip codes with the highest concentrations of overdose incidents are shown in dark purple. As you see, the zip codes in the north of the city and the south of the city of Memphis have the highest concentrations of overdose ED visits. The pattern is very similar to the overdose fatalities map that I showed you earlier. Now, the team and I had a really interesting, let's see if this works, yes. The team and I had a very interesting conversation about this area right here, all right? This 38028, all right? So the reason this is whited out is not because it means there are no overdoses. It means that we don't have any reports out of there. But all of us know that there is no way that that could be true, right? So we're still investigating why we don't have any data out of there, all right? I'll let you all conjecture why, but we don't have any data out of there. All right. This map, shown in shades of red, shows first responders' reports of non-fatal overdose events by zip code, reported through the OD map system. So remember, I told you we've got 3 strong folks who always report to OD map, right? Recall that not all municipalities are contributing to the data, which is why the zip codes in the far east of the county are shown in white. And so you see that white area got a lot bigger. So a lot of that is just not reporting. And I need you all's help with that, all right? If enough of us start bothering Bartlett and Collierville, and then I can nudge Shelby County Fire, I think we can start to get better reporting out of there, okay? The zip codes shown in dark red have the highest numbers of overdose emergency response events. The pattern is similar to what we've seen with other overdose events. This map in shades of green shows naloxone administration by zip code, as reported by first responders through OD map. The dark green areas have the highest number of naloxone doses administered. Remember, an overdose incident may require more than 1 dose of naloxone. The zip codes shown in white are now reporting incidents through OD map, is what my notes say. So hopefully that means that eventually, when we come back before you as a health department, we'll be able to shape that a bit better. All right, so current and future action. The Shelby County Health Department Opioid Response Plan has 5 pillars: prevention and education, treatment and recovery, first response and law enforcement, harm reduction and data usage, and integration. We are making progress in all of these categories, and we rely heavily on our partnering agencies to apply what we've learned through the data to the real-world conditions in the community. Those partners include MAP-C, Better Way, CAAP, or CAP, I'm assuming that's what that is, Shelby County School of Public Health, University of Memphis, EMS, I should have my glasses up here, you all, UTHSC Forensic Department, Hope House, Church Health Center, and many, many more. Our data-informed program goals are to decrease stigma that substance users encounter, reduce health disparities, increase social, cognitive, and behavioral support, improve behavioral health care access, and extend a feeling of security so that substance users feel safe in reaching out for the help they need. The cycle shown to the right is the synergistic improvements that better data can achieve. By continuing to improve data, we can identify gaps in linkage to care, ultimately expanding and strengthening the relationships among the overdose prevention partnering agencies with the goal of preventing more overdoses, saving lives, and linking users to treatment. the reason why we're all here. We use data to issue overdose spike alerts to inform our partnering agencies and the community at large of an increase in overdose events. Those spike alerts drive our start and stop event strategies, harm reduction kit distribution, community interventions, and other activities designed to address overdose spikes. Here is an overview of the spike alert response. When we issue an internal warning, we produce a brief report of statistics we have available for victims of fatal overdose, as well as data we can gather from ODMAP about where those overdoses have occurred. This gives us an opportunity to organize a meeting of partners to determine what steps should be taken immediately to respond to the spike. In the event of a public spike alert, we do all of the same things as in an internal warning alert, but more. In addition to the report and internal meeting, we also make the report public and post it on our website. We send out an alert to our opioid spike alert distribution list. We reach out to our community partners to notify them and send them to areas that need more naloxone distribution or to do outreach. And we will usually also prepare a press release to notify the media and the public about the overdose spike. And I'll stop here and say this. I get the opportunity to meet with other health directors around the country at least once or twice a year. And I will tell you that our alert system, while we're still making improvements, there are other places where they literally can do block by block analysis of what's going on with overdoses. And if they see a spike on a particular block, they have enough resources to send outreach workers right to that block. I'm hoping that eventually, with the help of all of you all in this room, we can get to that kind of action when an alert comes out. Here is a graphic representation of the actions we take from the first internal warning to issuing notifications to partnering agencies. When we receive multiple warnings, the actions we take includes notifications of our political leaders, the State Department of Health, the U.S. District Attorney's Office, and the local hospitals. This cycle of data triggering alerts and driving notifications and actions is repeated, culminating in an evaluation of our response efforts. And so the team can tell you that I've been in this role a little over 2 years. And we've been looking a lot at this and trying to figure out, like I was saying before, how we get to that block by block outreach when we're doing these alerts. Because it's not enough just to tell everybody else in higher up office. We have to make sure that the information is getting to you all so that you all can get the outreach efforts out on the streets. We can't do this alone. We understand that. That's why this room is full of people, right? And so just be looking for more of that coming out of the health department as we strive to make this response system even better, using the data that we're able to collect. There are strengths and challenges to this data-driven approach. The strengths include expanded and improved data collection and analysis, the successful collaboration between the health department's Population Health Bureau and community partners, and our epidemiology team that is skilled in analyzing and presenting data. Our challenges include dirty data, meaning, when you get data in, it's not always the best. You gotta clean it up. You gotta make sure it's accurate. You gotta know where it came from. Missing data, right? So you saw that on the maps, right? In the whited out areas. The difficulties of manually entering data, because we still do a lot of that. And working with multiple data systems with limited interoperability, meaning you might have a data system over here and one over here. They have two different types of information that you want to bring together, but the two systems don't talk, right? And most importantly, the challenge of explaining what this data means and what its limitations are, right? So I could stand up here all day long and show you maps, pie graphs, line charts, all of that. But we're still getting better at explaining what it means in the context of living in Shelby County. So, a couple of questions to drive continuous improvement, because that's what we are all about at the health department. How can we improve our response and ultimately reduce overdoses? Really? That's really what all of us are trying to do, and save lives. To achieve our goals, we must answer the questions such as, what drives substance use? What are the root causes? Including the social determinants of health that impact our vulnerable populations the most. And I will tell you that I'm one who, as a physician, as a public health practitioner, will tell you, everybody is vulnerable to substance use disorder. Everybody is a vulnerable population, if we're being honest with ourselves. Have we assessed the needs of the community, the true community need? Have we talked to the people who are struggling with this every day to really assess what is needed and what they're needing to get to optimal health? Are we fully utilizing the strengths of our community and our partnering organizations? We're asking that all of the time. And so by asking these continuous improvement questions, we will get to a better place where we're able to save even more lives than we already are as a community. So I want to take this time once again to thank you all for your attention, but to also thank our awesome team at Shelby County Health Department. They do this work every day. They work with all of you all every day. We really are about promoting, improving the health and lives of everybody in Shelby County. And we so thank you all for all the work you do to help us do a better job in the community. Thank you.